FHEA, Faculty for the Health Education of Advanced Practice, Exam Prep. Question 1. What is the primary focus of Malcolm Knowles' theory of andragogy? Option A, child-centered learning. Option B, teacher-led instruction. Option C, adult-centered learning and self-direction. Option D, rote memorization. The correct answer is option C, adult-centered learning and self-direction. Andragogy is the art and science of adult learning, emphasizing that adults are self-directed and take responsibility for their decisions. Question 2. According to Miller's pyramid of clinical competence, which level represents a student performing in a real clinical setting? Option A, knows. Option B, knows how. Option C, shows how. Option D, does. The correct answer is option D, does. The does level at the top of the pyramid refers to the assessment of performance in real-world practice, e.g., workplace-based assessments. Question 3. Which assessment method is most effective for evaluating an advanced practice student's clinical reasoning and interpersonal skills simultaneously? Option A, multiple choice questions, MCQs. Option B, objective structured clinical examination, OSCE. Option C, a true/false quiz. Option D, a self-reflective essay. The correct answer is option B, objective structured clinical examination, OSCE. OSCEs use standardized patients to observe and assess clinical skills, communication, and reasoning in a controlled environment. Question 4. In the context of feedback, what does the Pendleton's rules model prioritize? Option A, the educator's critique first. Option B, the learner identifying what they did well first. Option C, numerical grading. Option D, the immediate correction of errors. The correct answer is option B, the learner identifying what they did well first. Pendleton's model encourages the learner to reflect on their own strengths first to create a supportive and non-defensive environment. Question 5. Which of the following describes formative assessment? Option A, high-stakes testing at the end of a module. Option B, an assessment designed to provide feedback and support learning during the process. Option C, a national certification exam. Option D, the final grading of a dissertation. The correct answer is option B, an assessment designed to provide feedback and support learning during the process. Formative assessment is assessment for learning, providing ongoing feedback to help students improve. Question 6. What are the three domains of Bloom's taxonomy? Option A, cognitive affective psychomotor. Option B, reading writing arithmetic. Option C, history science math. Option D, visual auditory kinesthetic. The correct answer is option A, cognitive affective psychomotor. Bloom's taxonomy categorizes learning into thinking, cognitive, feeling, affective, and doing, psychomotor. Question 7. Which curriculum design involves revisiting topics at increasing levels of complexity? Option A, linear curriculum. Option B, spiral curriculum. Option C, static curriculum. Option D, a fragmented curriculum. The correct answer is option B, spiral curriculum. Bruner's spiral curriculum suggests that a curriculum should revisit basic ideas, repeatedly building upon them until the student has grasped the full formal apparatus. Question 8. What is interprofessional education, IPE? Option A, students of the same profession learning together. Option B, two or more professions learning with, from, and about each other. Option C, a doctor teaching a nurse. Option D, a lecture delivered to 500 students. The correct answer is option B, two or more professions learning with, from, and about each other. IPE occurs when students from different healthcare professions learn together to improve collaboration and the quality of care. Question 9. In Kirkpatrick's 4 levels of training evaluation, what does level 4 measure? Option A, the learner's reaction to the training. Option B, the change in behavior. Option C, the learning of new skills. Option D, the final results or impact on the organization/patient outcomes. The correct answer is option D, the final results or impact on the organization/patient outcomes. Level 4, results, measures the ultimate impact of the training, such as improved patient safety or reduced mortality rates. Question 10. Which learning theory suggests that learners construct new ideas based on their current and past knowledge? Option A, behaviorism. Option B, constructivism. Option C, humanism. Option D, cognitivism. The correct answer is option B, constructivism. Constructivism posits that learning is an active process where learners build new concepts based on existing knowledge. Question 11. What is the zone of proximal development (ZPD)? Option A, the area where a learner can do nothing. Option B, the gap between what a learner can do alone and what they can do with guidance. Option C, the distance between the classroom and the clinic. Option D, the level of mastery at graduation. The correct answer is option B, the gap between what a learner can do alone and what they can do with guidance. Developed by Vygotsky, ZPD is the range of tasks that a learner can perform with the help of a more knowledgeable other. Question 12. Which of the following is an example of a workplace-based assessment (WPBA)? Option A, final written exam. Option B, mini clinical evaluation exercise, mini CEX. Option C, anatomy lab quiz. Option D, a library-based research paper. The correct answer is option B, mini clinical evaluation exercise, mini CEX. The mini CEX is a snapshot of a clinical encounter used to evaluate a student's performance in a real-time setting. Question 13. What does reliability in assessment refer to? Option A, the test measures what it is supposed to measure. Option B, the consistency and stability of the assessment results. Option C, the difficulty level of the questions. Option D, the number of students who pass. The correct answer is option B, the consistency and stability of the assessment results. Reliability is the degree to which an assessment tool produces stable and consistent results over time. Question 14. What is the halo effect in clinical grading? Option A, grading all students as average. Option B, allowing a positive impression in one area to influence the overall grade in unrelated areas. Option C, giving the same grade to everyone in a group. Option D, a grading based on the student's height. The correct answer is option B, allowing a positive impression in one area to influence the overall grade in unrelated areas. The halo effect is a cognitive bias where a supervisor's overall positive feeling about a student colors their assessment of specific competencies. Question 15. Which of the following is a SMART learning objective? Option A, the student will understand heart failure. Option B, the student will be better at ECGs. Option C, the student will correctly identify 3 signs of heart failure on a chest X-ray by the end of the session. Option D, the student will study hard. The correct answer is option C. The student will correctly identify 3 signs of heart failure on a chest X-ray by the end of the session. SMART objectives are specific, measurable, achievable, relevant, and time-bound. Question 16. What is the primary goal of problem-based learning (PBL)? Option A, to memorize as many facts as possible. Option B, to develop critical thinking and problem-solving skills through real-world scenarios. Option C, to listen to a 2-hour lecture. Option D, to work alone in a library. The correct answer is option B, to develop critical thinking and problem-solving skills through real-world scenarios. PBL is a student-centered approach where learners learn about a subject by solving an open-ended problem. Question 17. According to Gibbs' reflective cycle, what follows the description of an event? Option A, a conclusion. Option B, feelings. Option C, action plan. Option D, evaluation. The correct answer is option B, feelings. The cycle follows description, feelings, evaluation, analysis, conclusion, action plan. Question 18. What is psychological safety in a simulation environment? Option A, the physical safety of the mannequins. Option B, a climate where learners feel comfortable taking risks and making mistakes without fear of ridicule. Option C, a locked classroom door. Option D, the use of real medications. The correct answer is option B. A climate where learners feel comfortable taking risks and making mistakes without fear of ridicule. Psychological safety is crucial in simulation to ensure that learners can explore their limits and learn from errors. Question 19. Which of the following is a synchronous learning activity? Option A. A pre-recorded video lecture. Option B. A live webinar with Q&A. Option C. An online discussion board. Option D. A self-paced reading assignment. The correct answer is option B. A live webinar with Q&A. Synchronous learning happens in real time where the teacher and students interact at the same time. Question 20. What is the purpose of a standard setting exercise, like the Enghoff method? Option A. To make the test easier. Option B. To determine the pass mark or cut score for an exam. Option C. To decide which textbook to use. Option D. To assign students to groups. The correct answer is option B. To determine the pass mark or cut score for an exam. Standard setting is a psychometric process used to ensure that the passing score reflects a minimum level of competence. Question 21. Which feedback model uses ask-tell-ask? Option A. The sandwich model. Option B. The adapt model. Option C. The ask-tell-ask model. Option D. The Pendleton model. The correct answer is option C. The ask-tell-ask model. Ask-tell-ask involves asking the learner for their self-assessment, telling them your observations, and then asking how they plan to improve. Question 22. What is cognitive load theory concerned with? Option A. The physical weight of the brain. Option B. The amount of information the working memory can hold at one time. Option C. The speed of light. Option D. The number of hours a student sleeps. The correct answer is option B. The amount of information the working memory can hold at one time. Cognitive load theory suggests that instruction should be designed to avoid overloading the limited capacity of working memory. Question 23. Which of the following describes double-loop learning? Option A. Correcting errors without questioning the underlying system. Option B. Changing underlying values and assumptions to prevent errors from recurring. Option C. Learning two things at once. Option D. Repeating a grade. The correct answer is option B. Changing underlying values and assumptions to prevent errors from recurring. Double-loop learning involves reflecting on the governing variables, the why rather than just the actions, the how. Question 24. In curriculum design, what is constructive alignment? Option A. Aligning the seats in a classroom. Option B. Ensuring learning activities and assessments are directly aligned with the intended learning outcomes. Option C. Constructing a new building. Option D. Hiring more faculty. The correct answer is option B. Ensuring learning activities and assessments are directly aligned with the intended learning outcomes. Biggs' theory of constructive alignment ensures that what the student does is directly related to what they are supposed to learn and how they are tested. Question 25. What is a rubric? Option A. A type of medical textbook. Option B. A scoring tool that explicitly represents the performance expectations for an assignment. Option C. A clinical protocol. Option D. A professional code of conduct. The correct answer is option B. A scoring tool that explicitly represents the performance expectations for an assignment. Rubrics provide clear criteria for grading, ensuring consistency and transparency for both students and markers. Question 26. Which of the following is a barrier to interprofessional collaboration? Option A. Common goals. Option B. Professional silos and tribalism. Option C. Mutual respect. Option D. Clear communication. The correct answer is option B. Professional silos and tribalism. Professional silos occur when different healthcare groups work in isolation and maintain rigid boundaries between their roles. Question 27. What is metacognition? Option A. Learning about history. Option B. Thinking about one's own thinking and learning processes. Option C. Memorizing a list of drugs. Option D. A type of physical therapy. The correct answer is option B. Thinking about one's own thinking and learning processes. Metacognition involves self-awareness of how one learns and the ability to monitor and regulate one's own learning. Question 28. Which of the following is a key feature of experiential learning? Kolb. Option A, passive listening. Option B, a cycle of concrete experience, reflective observation, abstract conceptualization, and active experimentation. Option C, reading about a skill without practicing it. Option D, taking a multiple choice test. The correct answer is option B, a cycle of concrete experience, reflective observation, abstract conceptualization, and active experimentation. Kolb's cycle emphasizes that learning is a continuous process grounded in experience and reflection. Question 29. What is hidden curriculum? Option A, the list of books in the library. Option B, the unwritten, unofficial, and often unintended lessons and values learned in a clinical setting. Option C, a secret syllabus. Option D, a night school program. The correct answer is option B, the unwritten, unofficial, and often unintended lessons and values learned in a clinical setting. The hidden curriculum refers to the cultural and social norms students pick up by observing the behaviors of their mentors and peers. Question 30. What is the Dunning-Kruger effect? Option A, a type of heart rhythm. Option B, a cognitive bias where people with low ability at a task overestimate their ability. Option C, a teaching method for surgeons. Option D, the result of too much caffeine. The correct answer is option B, a cognitive bias where people with low ability at a task overestimate their ability. In education, this is seen when low-performing students are unaware of their incompetence and fail to seek help. Question 31. Which assessment is known for high validity but often low reliability in the absence of standardization? Option A, long case clinical exam. Option B, multiple choice questions. Option C, computer-based simulation. Option D, a true/false questions. The correct answer is option A, long case clinical exam. Long cases are highly authentic, valid, but because every patient is different and every examiner has different standards, they can be unreliable. Question 32. What is the sandwich method of feedback? Option A, giving feedback while eating. Option B, positive feedback followed by constructive criticism followed by positive feedback. Option C, giving 3 pieces of negative feedback. Option D, giving feedback only at the end of the year. The correct answer is option B, positive feedback followed by constructive criticism followed by positive feedback. The feedback sandwich is a common but sometimes criticized method intended to soften the blow of criticism. Question 33. Which of the following defines scholarship of teaching and learning? SOTL. Option A, giving a good lecture. Option B, is systematically studying and making public the results of teaching and learning innovations. Option C, having a PhD. Option D, writing a textbook. The correct answer is option B, systematically studying and making public the results of teaching and learning innovations. SOTL involves practitioners treating their teaching as a form of research and sharing findings to improve the field. Question 34. What is preceptorship? Option A, a formal classroom lecture. Option B, a period of structured transition for a newly qualified practitioner supported by an experienced colleague. Option C, a type of medical license. Option D, a graduation ceremony. The correct answer is option B, a period of structured transition for a newly qualified practitioner supported by an experienced colleague. Preceptorship provides support for the transition shock experienced when moving from student to practitioner. Question 35. Which of the following is humanist learning theory? Option A, learning via rewards and punishments. Option B, learning through self-actualization and personal growth. Option C, learning through rote repetition. Option D, learning by observing machines. The correct answer is option B, learning through self-actualization and personal growth. Humanism, e.g. Maslow-Rogers, focuses on the whole person and the importance of individual growth and autonomy. Question 36. In assessment, what is validity? Option A, the test is consistent. Option B, The test measures what it claims to measure. Option C. The test is easy to grade. Option D. The test is taken by many people. The correct answer is option B. The test measures what it claims to measure. Validity ensures that the assessment actually evaluates the specific learning outcomes intended. Question 37. What is a virtual learning environment, VLE? Option A. A hospital ward. Option B. An online platform, like Moodle or Canvas, for managing course materials and activities. Option C. A stethoscope. Option D. A physical classroom. The correct answer is option B. An online platform, like Moodle or Canvas, for managing course materials and activities. VLEs are essential for modern blended learning to store resources, track progress, and host discussions. Question 38. What is flipped classroom? Option A. The teacher stands at the back of the room. Option B. Students study the content before class and use class time for active problem solving. Option C. The students teach the teacher. Option D. The classroom has no desks. The correct answer is option B. Students study the content before class and use class time for active problem solving. Flipped learning moves the lecture to the home and the homework to the classroom. Question 39. Which of the following describes professional identity formation? Option A. Learning how to use a computer. Option B. The process of internalizing a profession's core values and thinking, acting, and feeling like a professional. Option C. Getting a high salary. Option D. Wearing a uniform. The correct answer is option B. The process of internalizing a profession's core values and thinking, acting, and feeling like a professional. Advanced practice education is as much about becoming a practitioner as it is about knowing the medicine. Question 40. What is reflective practice? Option A. Looking in a mirror. Option B. The process of thinking about one's actions to engage in a process of continuous learning. Option C. Copying exactly what a mentor does. Option D is summarizing a textbook. The correct answer is option B. The process of thinking about one's actions to engage in a process of continuous learning. Reflective practice is a cornerstone of professional development in healthcare. Sean, 1983. Question 41. What is curriculum alignment? Option A. The physical layout of the building. Option B. Ensuring that the learning outcomes, activities, and assessments are all in sync. Option C. Hiring the right number of staff. Option D. Making sure all students have the same books. The correct answer is option B. Ensuring that the learning outcomes, activities, and assessments are all in sync. Alignment ensures there are no surprises in the exam and that the teaching supports the stated goals. Question 42. Which of the following is behaviorist teaching? Option A. Encouraging self-discovery. Option B. Using positive reinforcement, rewards, to shape desired behaviors. Option C. Reflecting on feelings. Option D. Group discussion. The correct answer is option B. Using positive reinforcement, rewards, to shape desired behaviors. Behaviorism, Skinner-Pavlov, focuses on observable behaviors and external stimuli. Question 43. What is a Likert scale? Option A. A tool for measuring blood pressure. Option B. A rating scale used in surveys to measure attitudes or opinions, e.g., strongly agree to strongly disagree. Option C. A surgical instrument. Option D. A measure of lung capacity. The correct answer is option B. A rating scale used in surveys to measure attitudes or opinions, e.g., strongly agree to strongly disagree. Likert scales are commonly used in course evaluations to gather student feedback on teaching quality. Question 44. What is gamification in education? Option A. Playing video games instead of studying. Option B. Using game design elements, like points and leaderboards, in non-game contexts to increase engagement. Option C. Developing a new board game. Option D. A type of sports coaching. The correct answer is option B. Using game design elements, like points and leaderboards, in non-game contexts to increase engagement. Gamification aims to increase motivation and participation by making learning more interactive and competitive. Question 45. Which of the following is implicit bias? Option A. Clearly stated prejudice. Option B. Unconscious associations or stereotypes that affect our understanding and actions. Option C. A formal policy on diversity. Option D. A religious belief. The correct answer is option B. Unconscious associations or stereotypes that affect our understanding and actions. In healthcare education, it is critical to address implicit bias to reduce health disparities in patient care. Question 46. What is clinical supervision? Option A. The act of managing the hospital budget. Option B. A formal process of professional support and learning which enables practitioners to develop knowledge and competence. Option C. Watching a student from a distance. Option D. Checking a student's attendance. The correct answer is option B. A formal process of professional support and learning which enables practitioners to develop knowledge and competence. Clinical supervision is a collaborative process that promotes safety and professional growth. Question 47. What is summative assessment? Option A. A quick check of understanding. Option B. The final assessment used to determine if a student has met the learning goals for a grade or certification. Option C. A feedback given in the middle of a shift. Option D. A self-assessment. The correct answer is option B. The final assessment used to determine if a student has met the learning goals for a grade or certification. Summative assessment is assessment of learning, the final tally. Question 48. What is self-efficacy, Bandura? Option A. The ability to work alone. Option B. One's belief in their ability to succeed in specific situations or accomplish a task. Option C. Being selfish. Option D. The amount of money one earns. The correct answer is option B. One's belief in their ability to succeed in specific situations or accomplish a task. High self-efficacy in students is linked to greater persistence and better learning outcomes. Question 49. What is scaffolding? Option A. A type of surgical support. Option B. A temporary support provided to a learner to help them complete a task they cannot yet do alone. Option C. A physical ladder. Option D. A method of cleaning the clinic. The correct answer is option B. Temporary support provided to a learner to help them complete a task they cannot yet do alone. Scaffolding is gradually removed as the learner gains independence and mastery. Question 50. What is Socratic questioning? Option A. Giving the student all the answers. Option B. A form of disciplined questioning that can be used to pursue thought in many directions and for many purposes. Option C. Asking only yes or no questions. Option D. Refusing to speak to the student. The correct answer is option B. A form of disciplined questioning that can be used to pursue thought in many directions and for many purposes. Socratic questioning challenges the student to think critically and uncover their own underlying assumptions. Question 51. Which of the following is inquiry-based learning? Option A. Students follow a strict recipe for an experiment. Option B. Students start with a question and conduct research/investigation to find the answer. Option C. Teacher reads from a textbook. Option D. Students memorize a list of dates. The correct answer is option B. Students start with a question and conduct research/investigation to find the answer. Inquiry-based learning emphasizes the student's role in the learning process by encouraging them to explore the material. Question 52. What is conative domain in learning? Option A. The domain of thinking. Option B. The domain of feeling. Option C. The domain of doing or striving, the will to act. Option D. The domain of memory. The correct answer is option C. The domain of doing or striving, the will to act. While Bloom focuses on cognitive affective psychomotor, the conative domain refers to the drive and will to perform. Question 53. Which of the following is a high-stakes exam? Option A. A weekly quiz that doesn't count for marks. Option B. A national board certification exam. Option C. A self-practice test. Option D. A group discussion. The correct answer is option B. A national board certification exam. High-stakes exams have significant consequences for the learner, e.g. graduation or licensure. Question 54. What is mentorship? Option A. A short-term focus on a single skill. Option B. A long-term relationship focused on the overall professional and personal development of the mentee. Option C. A boss-employee relationship. Option D. A type of medical textbook. The correct answer is option B. A long-term relationship focused on the overall professional and personal development of the mentee. Mentors provide guidance, support, and advocacy over an extended period. Question 55. What is transformative learning, Mazairo? Option A. Learning a new fact. Option B. Learning that changes the way we see the world and ourselves, shifting perspectives. Option C. Learning how to drive. Option D. Learning a second language. The correct answer is option B. Learning that changes the way we see the world and ourselves, shifting perspectives. Transformative learning occurs when a learner experiences a disorienting dilemma that causes them to re-evaluate their beliefs. Question 56. What is deliberate practice, Erickson? Option A. Practicing the same thing the same way for years. Option B. A highly structured activity with the specific goal of improving performance through constant feedback. Option C. Watching someone else practice. Option D. Reading a manual. The correct answer is option B. A highly structured activity with the specific goal of improving performance through constant feedback. Deliberate practice is the key to moving from a competent to an expert level of performance. Question 57. What is clinical governance? Option A. The political party in charge of the hospital. Option B. A framework through which organizations are accountable for continuously improving the quality of their services. Option C. The name of the hospital board. Option D. A set of rules for doctors only. The correct answer is option B. A framework through which organizations are accountable for continuously improving the quality of their services. In education, clinical governance ensures that the training of staff leads to safe and effective patient care. Question 58. What is anchored instruction? Option A. Learning while on a boat. Option B. Using a macro context or realistic story as an anchor for all the learning in a module. Option C. A type of physical restraint. Option D. Memorizing a list of facts. The correct answer is option B. Using a macro context or realistic story as an anchor for all the learning in a module. Anchored instruction helps students see the relevance of the material to real-world clinical problems. Question 59. Which of the following is a qualitative research method in education? Option A. An MCQ exam. Option B. A focus group. Option C. A standardized test score. Option D. A demographic survey. The correct answer is option B. A focus group. Qualitative methods explore the why and how through interviews, observations, and focus groups. Question 60. What is authentic assessment? Option A. An exam with no cheating. Option B. An assessment that requires students to perform real-world tasks that demonstrate meaningful application of essential knowledge and skills. Option C. A test with a strict time limit. Option D. An exam given in a church. The correct answer is option B. An assessment that requires students to perform real-world tasks that demonstrate meaningful application of essential knowledge and skills. Authentic assessments, like a clinic simulation, mirror the actual challenges of the professional role.